If you are a woman who has a very active lifestyle, you can continue that. You can continue to exercise what you are doing before pregnancy. If your pre-pregnancy weight is on the higher side, too much weight gain during pregnancy is not good. Poor dental hygiene is responsible for poor fetal outcome also. Journey to motherhood becomes more fulfilling when you and your baby are in the best of their health. What are the ways to a healthy pregnancy? Is one of the most common questions asked to me by my patients. Hello, I'm Dr. Avani Pillai, Senior Consultant and Associate Professor, Fertility, Obstetrics and Gynaecology from Amrita Hospital, Kochi. Today I'm going to share with you 10 pregnancy health tips. 1. Diet. Make sure you eat the right amount of food and also the right foods. Your food should consist of carbohydrates, proteins, minerals and vitamins, and also good fats. The right choice of carbohydrates is very important. You can go for brown breads, wheat products rather than going for rice and other products like that. Proteins is a very important part of the diet, and women very often get excess of pedal edema or swelling in the feet due to lack of proteins. So make sure you eat enough amounts of dals, pulses in your diet, fish, chicken, eggs. All these are rich sources of proteins. Minerals and vitamins. Fruits and vegetables are rich sources of minerals as well as vitamins. Go for organic as well as locally available fruits and vegetables, which is best. Also, vitamin D is very important to include in the diet. If you are not fond of milk, you can go for other sources of vitamin D like curds, cheese, paneer, etc. Walnuts, dry fruits are very good. Walnuts are a rich source of omega-3 fatty acids, which is very important from the brain development of your child. Make sure you include plenty of water. At least 2 to 3 liters of water every day is very important for a pregnant woman to be hydrated as well as avoid constipation. What are the don'ts in pregnancy? Make sure you avoid all artificial products with preservatives like packed juices, sauces, etc. Secondly, avoid excess of salt, especially if you have high blood pressure in pregnancy. Excessive salty foods like pickles and papadums have to be avoided. Also avoid spicy foods, which gives pregnant women a lot of gastritis. Make sure you eat short and frequent meals. Also to be avoided in pregnancy is excess of tea and coffee. Also avoid outside foods. Foods which are, especially meats which are partially cooked, are a source of infections like toxoplasma, salmonellosis, which can be not only dangerous to you but also to your baby. So make sure you avoid all these products. Exercise. Exercising at least 3 times a week is very important, and it's beneficial to increase the blood supply to your body as well as to increase the nutritional supply to your baby. Walking is one of the preferred way of exercising for most women, but exercising is very relative. It depends on what your body is used to before pregnancy. If you are a woman who has a very active lifestyle, you can continue that. You can continue to exercise what you are doing before pregnancy. But if you are used to a very sedentary and a lifestyle which does not include physical activity, better to avoid any exercise which strains you. The key is to avoid excessive strain during pregnancy throughout all the trimesters. Weight gain during pregnancy should be around averagely 10 to 12 kgs. If your pre-pregnancy weight is on the higher side, too much weight gain during pregnancy is not good. Especially more than 2.5 kgs per month weight gain is not healthy. And make sure if that happens, you make sure your blood pressure is checked. It could be a sign of high blood pressure. 4th, rest. A pregnant woman has to take adequate rest. Around 8 to 10 hours of sleep at night is very important. Also 1 hour of rest in the afternoon in the lying down position is helpful. After 7 months, it's advisable to rest in the left lateral position, because in this position the blood supply to the baby is increased and it helps for the overall well-being for the baby. Even the fetal movement count is done in this position because baby is more active, and in 1 hour you are supposed to see around 3 to 4 fetal movements. 5th, visits to a gynecologist. All women, especially who are trying for pregnancy, should maintain a menstrual calendar. so that whenever you miss periods, you do the pregnancy test immediately and take the necessary precautions for pregnancy. Visit the gynecologist as soon as your pregnancy test is positive. The visits to a gynecologist is usually once in a month up to 28 weeks of pregnancy, then fortnightly, and after 36 weeks, every week visits are advisable. The gynecologist will assess you, and according to our individual problems in your particular pregnancy, she will give you further guidance for further follow-up. Nutritional supplements. Make sure that all women who are trying to conceive take folic acids regularly. It is recommended to take folic acid at least 3 months prior to conception and till 3 months of pregnancy. It prevents having anomalies, especially neurological anomalies in the baby. Iron and calcium supplements are given to all pregnant women from 3 months of pregnancy, and they should take it regularly throughout, after birth also, up to when they are breastfeeding. Iron and calcium should be taken at different times. You can have iron with a glass of lime juice, which will help in better absorption of iron. Other supplement which is important is vitamin D. It is also given to pregnant women throughout pregnancy. It also helps in bone development of the baby and helps the mother to be deficient in vitamin D and calcium. Clothing. Make sure that you wear loose and comfortable cotton clothes. Pregnancy increases your body temperature due to the hormones, and wearing comfortable clothes will make you feel healthy and comfortable throughout the day. Also make sure you wear comfortable clothes. Avoid wearing excess of heels, which will cause back pains. Posture is very important in pregnancy. You have to make sure that you are always well supported, your back is well supported, your feet is touching the ground, and you sit in comfortable postures. Pregnant women often complain a lot about backaches and joint pains, etc. It is mainly due to bad postures. If you are very careful during getting up from a chair or getting up from lying down position, you turn on a side and take adequate support while and don't suddenly change positions, it will go a long way in avoiding back pains and all these aches and pains during pregnancy. Travel. Avoid traveling on bad roads, especially during first 3 months of pregnancy, and especially for women who have a history of miscarriage. Air travel is safe as well as train travel, and during the last 1 month of pregnancy, make sure if you're traveling or sitting for a long duration, make sure that you keep moving your legs. It will avoid causing blood clotting, which can be a serious complications. So during long travel, make sure you keep moving your feet, flexing your feet so that your blood circulation is maintained. Intercourse. Avoid intercourse in the first 3 months of pregnancy, especially if you have had a history of miscarriage. Also avoid intercourse in the last month of pregnancy. Hygiene. Make sure you daily take a shower, wear clean clothes, frequently change your undergarments, and maintain good hygiene throughout pregnancy. Dental hygiene is very important during pregnancy. If you have any symptoms of infection, dental infection, you have to consult the doctor soon. Poor dental hygiene is responsible for poor fetal outcome also. So make sure you follow all these pregnancy health tips. At the same time, don't forget to relax, enjoy every moment of this beautiful journey. Thank you.